CAM lesions are more common and presented in young athletes, usually developed during developmental ages, adolescence, or when they're growing and they're also doing a high volume of activity. So based on his clinical presentation of stiffness in his hip going into hip flexion, internal rotation, we're thinking he has a possible CAM lesion. He did get an MRI, but it wasn't clear that he has a clear CAM lesion, so we have to go back into getting more imaging done with contrast to confirm that he actually is dealing with a CAM lesion. Yeah, so we'll go over the difference between CAM lesion and pincer lesion. So CAM lesion, if we're thinking of the femoral neck, right, the femur head going into the socket of the hip joint, there's a little like bone spur, a little bump on top of the femoral head. So you feel a lot of stiffness when you're going this way. It doesn't sit into the socket of the hip socket really, really well. Pincer lesion, usually there's a bump around the outside of the rim of the hip socket. So that's a difference between pincer lesion and CAM lesion.